The young child, 24 to 36 months, and even a little bit beyond 36 months into the third year, likes to run and jump and play and stomp. And they're very vigorous and energetic, enthusiastic, and language development during this time is very rapid. And so when we think about their growth and development at this age, we need to think about, first of all, what is average for their size, so we kind of get an idea about what is the normal range. Remember, average is just a range. Doesn't mean that if a child is below it or above it that they are abnormal. They're just not in the typical average range. So for girls, starting out at 24 months, they typically are about 31.5 inches tall. And by 36 months, they can grow up to about 40 inches, and that's the average range. And they're about 26.5 pounds to 38 pounds. For boys, it's slightly different. Boys are 34.5 inches to about 40.5 inches, and they are 28 to 38 pounds. The rate of change in the child is more important than the percentile ranking. If your child, when you take your child to the doctor will say they're in the 40th percentile ranking or the 60th percentile ranking. What the doctor is looking for is the more consistent year-to-year ranking in and around the same spot. It's more important, even if your child's in the 10th percentile, that they're in the 10th or 15th percentile the next year. What indicates problems is when they jump from one ranking to another in a large span. The other issue is if there might be a problem if there's a difference between, say, their height ranking and their weight ranking. So if a child is extremely tall and low in weight, then they might be way underweight and it might be a nutrition issue. Or if a child is extremely has high on the scale with weight and low on the scale with height, then they might have an obesity issue, and again, it might become a nutrition issue. So we look at some of their physical characteristics of a child in this range, and we know that they can jump from low objects, and they like to jump. They're pretty fearless. They can climb, they can run, but they don't change directions very well or very quickly. They like to sit on riding toys. They like to push with their feet, and they may try to ride a tricycle. They throw things using their forearms. Their fine motor development is beginning to increase. They can kick a ball if the ball is still, and they're just learning to use their bodies. So some of the goals that we have for children in the 24 to 36 month range is to strengthen their small muscles. So we might give them activities like cutting and tearing and drawing and lacing. We want them to develop their eye-hand coordination, so that would help some of their pre-writing skills. And we want them to develop large muscle skills, so we put out activities like climbing and skipping and catching a ball. Some of the suggested activities and materials for children in this range are allowing them to run and to throw, to catch, to jump, to climb, to ride on riding toys, to climb on low structures, to use modeling clay. It's good for them to use blocks and puzzles, containers that can be filled and emptied, but they need to have supervision so they don't put things in their mouth and in their ears. Lacing and sewing activities, cutting and pasting activities are also good for their motor skills. Now, cognitively, children in this domain respond to simple directions. You might be able to tell them to come here or put that down, so they can respond to those directions. They have a very limited attention span. They begin to count and put things in order and sequence, and they can match some objects. They begin imitating adults. You might see a child put a block up to their ear and they're pretending that they're on the phone, just like they might see their parents do. Or they might pretend to make motor noises and drive. They begin to use more language in play, so when they're playing you might hear them burst out with words. Their vocabulary begins to greatly increase. They can speak in simple phrases, like 2 and 3 words. And they have a lively imagination. They love to pretend, and gradually they like to focus more on their own image and less on other images like pictures and books and things like that. Some of the learning goals for their brain development are to help them to develop reasoning and problem-solving skills. So you might be working with blocks and ask them how can they make it higher. And so working with problem-solving skills, working out problems mentally rather than through trial and error. So you might talk through a problem with a child. Expand their creativity and their logical thinking. Develop reading readiness skills like turning the pages from left to right. Increase vocabulary, memory, and speech by labeling items in books and asking questions. And develop counting sequences and matching skills. So some suggested activities and materials might be letting children work out their problems independently, just stepping back, not putting your hands on it, letting them try to figure it out. Encourage creativity with large pegs to group, or sort or stack, or paints or crayons. Talking clearly to children, to use simple and positive statements, and allowing children to respond back. You have to give them the time to respond back. Exposing children to a variety of books, like picture books, short stories, poems, rhymes. Ask children to guess what's going to come next in the story. Ask children to picture things that have happened in the past or might happen in the future. Sing throughout the day, and bend your knees and get down to their level and make eye contact with them when you're talking to them. Socially and emotionally, some of the characteristics of a child of this age, they like to play near and watch other children. They don't necessarily play with children, but they play with beside them, kind of parallel play, and they like to watch what they're doing. They like to pretend and role play and have a great fantasy life in their mind. They say no often and are protective of their own possessions. They're usually pleasant, but still establishing independence, and sometimes can be stubborn and sometimes can be negative and demanding. And they recognize expressions and emotions, so they know when you're happy and when mommy's happy, or when daddy's happy, or when he's in trouble or something like that. They may start to develop fears, and they start an activity if you suggest something to them. Some of the goals for the child in the social emotional domain are to learn to use words to settle their arguments, begin to learn to get along with others, learn about feeling and that it's okay to feel silly, it's okay to feel sad, it's okay to feel happy, it's okay to feel angry, and all those different feelings. They're learning to be a separate person apart from mommy and daddy. And they're beginning to learn to respect the rights of others, and they're beginning to learn to share. And they're also learning a little bit about managing conflict. Some of the suggested activities and materials for children of this age to enhance their social emotional development are to encourage creative expression, encourage sharing and taking turns, using finger play with them, providing opportunities for dramatic play and simple themes and props, having a multiples of popular toys and materials available. If something's popular, that means that there's going to be a fight over it. So having enough that all the children can play with it, or a system of which they can take turns, is going to help prevent conflict. Encourage children to state their feelings and intentions. Deal calmly with fears and without making fun of children. And explain the rules and consequences of behavior so that children can learn from the whys, and point out how a child's behavior can affect other children or other people. Now, the perceptual domain, the self-help skills, the child from this age, they can feed themselves, they can wash and dry their hands with help, they can begin to be toilet trained, they can dress themselves with help, and they can help put things away. Some of the goals in this domain are to develop positive self-esteem, to become more confident of their abilities, and to become more independent. So some suggested activities and materials for the self-help or the perceptual domain are to encourage children to serve themselves, help set the table, wash their own hands, put on their own socks or put on their own shoes if they're able to. So you can provide soap and towels and child-sized utensils. You can sit with the children during meals and encourage conversation, and you can give simple responsibilities which can be accomplished for the child. Now, in the early childhood environment, it's important to have in your classroom a diapering area and a bathroom, an eating area and a play area. that's divided into centers. Those centers should be like a book or a reading, language, literacy area, a place for manipulatives and blocks, a place for dramatic play, a place for music and movement, a place for art, a large motor area, that could be in your music and movement area. The environment should be rich in both written and oral language with lots of books and storytelling, lots of talking back and forth, conversations with children. Everything should have labels. Even though they can't read it, they can begin to recognize shapes of words. So label the different parts of the room or area. The reading area should have a cozy, inviting space with pillows and puppets and stuffed animals and flannel boards. And the outside area should have sun and it should have shade, and it needs to have a resilient ground cover. Children fall down a lot, and they run, they trip, they jump off of things, so the ground cover should be somewhat resilient. And it should include swings, low climbers, playhouses, and sand toys, sand boxes. Individual attention is really important. Close supervision of children in this age group is important. Responsive caregiving is critical to their future development. Now, children in this age need to go to the doctor. Every child needs to go every year to the doctor. But they should have their immunizations. Their immunizations that they need are their hepatitis B, the HIV vaccine, HIB, polio, DTaP, DTaP, or DTP, their MMR, and their chickenpox vaccination. So you need to make sure that they're up to date on their vaccinations. Nutrition is important at this age. Children at this age become very picky eaters and oftentimes lose interest in foods. You may find that there are some days that your child may not be interested in food at all, and other days he might only want to eat certain types of food. Be assured that when your child's hungry, he'll want to eat. It's important maybe to have a staple of certain types of foods that the child likes to eat, like yogurt or peanut butter, or things that are going to provide some basic nutrition for them that you know that they'll eat. And don't be alarmed if they eat that for a whole week straight. They're not going to become malnourished because they're eating peanut butter and yogurt for a week straight. A child at this age changes their sleep a little bit. They begin to move from the crib to the bed. And so it's important just to maintain things as closely as possible to the routine that you've already established. And just make sure that you stick to the bedtime. Make the transition exciting by talking about the big boy or big girl bed. Continue with your normal activities like reading to them before they go to bed. And move everything out of the way around their bed, so if they get up out of bed at nighttime, they're not going to trip and fall. Toilet training is a big deal during this age. Around this time, your child will begin to show signs that they are ready for toilet training. And if you have questions, talk to your healthcare provider, but in general, your child is ready if he does some of the following. The child can pull his pants up and down himself. The child's interested in the toilet and imitates other bathroom habits. The child can and will follow simple instructions. The child dislikes the feeling of having a dirty diaper. The child understands the physical signs that indicate that he has to go before going. And the child can have long dry periods. So those are all signs that your child is ready to begin potty training. Just remember that you need to be ready to start. Don't try to push a child to start if they're not ready. There is a range in that. Your child's probably not going to get on the bus wearing Pampers. So make sure that the child is ready to begin potty training. And last of all, we need to talk about safety. And choose toys that don't have small parts. And although your child has probably mastered the stairs, in corners you should still block staircases, you should still latch cabinets, toilets, drawers, things that they can get into that you don't want them to get into. And last of all, you should know the poison control number. And if you think your child has ingested something, don't wait to see what would happen, just call the poison control. And that number is 1-800-222-1222.